Okay, so this is a 32-year-old male, diesel mechanic. No known health history. He has a family health history of leukemia, stomach cancer, lung cancer, breast cancer, and hypertension. Only surgeries he's had are tubes in his ears. Only medication he takes is over-the-counter Aleve for chronic joint pain. So we're going to be doing a physical assessment on him. I'm going to inspect the face and skin to make sure there's no abnormalities. I'm also going to inspect the face for expression and symmetry. And they're symmetric to me. I'm going to inspect and palpate the scalp and the cranium. No abnormalities. Alright, we're going to we're going to palpate the temporal arteries. I just need to pay attention if it's off. That feels good. Alright, I'm going to test the jaws for TMJ. Can you open your mouth? Close it. One more time. Close it. Alright. That feels good. Alright, we're going to touch cranial nerve number 5. So I want you to open your mouth for me, and I'm going to hold your chin, and I want you to see if you can, I just want you to pick it back up. Alright, perfect. I want you to close your eyes for me. Does that feel the same?
Yes.
Okay. Alright. Now we're going to touch cranial nerve number 7. I want you to smile real big for me. Alright, frown. Close your eyes. Squeeze them really, really tight. Alright, lift your eyebrows. And I want you to show your teeth and do a puff face. Perfect. Alright. We're going to check cranial nerve number 2. That's going to be the visual acuity. And I just want you to see if you can read these letters for me. Alright, can you read the top?
TC0.
Alright, this one?
PT0C.
This one?
ZLPED.
This one?
ETODCF.
This one?
DPC. ZLFTCFDTE. OPL, LD, CZOTEP.
Alright, that was 20/20 vision right there, so your eyes are good. Alright, I'm going to check your pupils. If you'll just look straight for me, I'm just going to shine a light in your eye, okay? I need you to keep your eyes open though.
Right.
Alright, I'm going to do the other one. One more time. Alright. And I'm just going to also inspect, I'm just going to look at the sclera and all that of your eye, okay? Just make sure it's not red or anything. Open up. Alright, that looks good. Now I'm going to get you to, I'm going to just look at your eyebrows and your eyelids. I'm going to feel around. Alright, all that feels normal. Now I'm going to inspect and palpate your ears. Feel any abnormalities or see any. Alright, we're going to do something called a whisper test. It tests your cranial nerve number 8. Alright, so I just want you to repeat what you think I whisper to you, okay?
Sausage. Patty. Cat. Mouse.
Alright, perfect. Alright, so now we're going to just look at your nose. I'm going to palpate your sinuses, and we're going to check your nose out. Any tenderness, any sinus problems?
No.
Alright, I want you to put one finger over your nose, sniff, and the other one. Perfect. Alright, so if you'll just open up real big and wide for me, I'm going to check the back of your mouth and check the back of your throat. Yep, say ah. Alright, perfect. Tonsils look good, mucosa looks good. Tonsils are a grade 2. Alright, you already said which checks one of the nerves for me, but I need to check another one. We're going to check your gag reflex. That's going to be cranial nerve number 9. open up. Alright, perfect. Alright, I need you to stick your tongue out. This is checking cranial nerve number 7. I want you to move it back and forth for me. Okay. Alright, now we're just going to check out your lymph nodes. Any tenderness?
No.
I don't feel any swelling. Alright. Now I want you to, this is checking another cranial nerve. I want you to checking cranial nerve number 11, chin to chest. Alright, pick your head up, turn it side to side. Perfect. I'm going to check out your trachea and thyroid. Everything's good there. I'm going to check your carotid on both sides. Palpable. And that one's good too. Now I'm going to listen to them. Good. Just auscultating the carotid breathes. Alright. I'm gonna look in the back of your chest. Your back. Alright. Alright. I want you to say the number 9 for me.
9.
Again?
9.
Perfect. Alright. I'm just gonna bang on your chest, or bang on your back.
11.
That's not, no. Just palpating the back. Percussing, really. Alright, I'm gonna do your flanks. Tell me if you have any tenderness. No tenderness?
No.
Okay. Alright. Listen to you. Get you to take a deep breath. Okay. Lung sounds are clear. Let me check the front real quick. Take a deep breath. Alright, clear 2. Okay. So we're going to look at your arms now. So if you'll just hold your arms out for me. Alright. I'm going to feel a pulse. Checking the radial, brachial, and ulnar pulses. Alright, pulses are 2+ on the left side. I'm going to check the right side. Alright, pulses are good on this right side. Now I'm going to check your reflexes, okay? Reflexes are 2+ on that side, on the right side. Reflexes are good on that left side too. Alright, I want you to, let me see your finger. I'm going to check for calf refill. Let me see your other finger. Calf refill is less than 3 seconds. I want you to raise your hands above your shoulders. Move your shoulders around. Alright. Put your arms out. Bend your elbows. Then back out. Can you turn them? Alright. I want to see if you can do range of motions of your wrist. Okay. Shoulders, elbows, and wrists. Range of motion looks great. I want you to hold your hands out and close your eyes. I'm going to draw something in your hands. I want you to tell me what it is, okay? And it's going to be a letter.
B.
Okay, good. I'm going to do this hand. you to tell me what you feel in your hand.
Mama's ring.
It is in fact a ring. It's a ring. Now we're gonna do the other hand.
Pen.
Yep. Perfect. Alright. So now I'm gonna just take a look at your chest. Let me just breathe normal. I'm inspecting his work of breathing and looking at his chest. And I'm just gonna feel around. I don't feel any abnormalities. Alright. I'm gonna listen to your heart and with the diaphragm and the bell. And I'm gonna listen to PMI and Erb's point. Make sure your heart sounds good. Heart's beating a little fast, but
Heart always beats fast, honey.
okay. Heart sounds good. Now I'm just gonna take a look at your abdomen. I'm just gonna take a look at your skin. Skin looks good. Umbilicus looks good. Alright, I'm just gonna listen to your to your stomach, your bowel sounds. Okay, I'm also going to ask you to take your aorta and your bilateral renal arteries. Aorta sounds good. Left renal artery sounds good. Right renal artery sounds good. Alright. Now I'm just gonna percuss all 4 quadrants. No abnormalities. I'm gonna palpate your stomach and you just tell me if you feel any tenderness. Did you feel any tenderness?
No.
Okay. I'm gonna palpate for your liver. The liver is unpalpable.
Is that good or bad?
It's fine. Just because you're slightly overweight. Alright, I'm gonna inspect and palpate your
Again
leg.
with the fat.
Alright, I need you to let me see this leg. Alright, leg looks good. Any problems with your legs lately?
No.
No? Okay. I'm just gonna check for your pulses. Alright. Pulses and feet are good. Alright, can I see your feet? No edema on the left side. No edema on the right side. Okay, what I need you to do is to stand up for me. I want you to bring your knee up. Alright. Rotate it out.
You said what?
Bring it, rotate it out. Alright, put it back down. Alright, do the same thing with this leg. No, rotate it out. Good deal. Alright. Now, I need you to sit back down for me. Alright. I want you to try to pick your foot this foot up. Alright. This one. Alright, pick your leg up. I want you to go against my little hand. Push down. Alright, perfect. Push down. Alright. Alright, I need you to take this heel, put it on this shin, and go down your leg. Alright, this one with this one. Okay. Alright. Now I'm going to check your reflexes and your knee and your ankle. Alright, perfect. Alright.
First time my legs ever moved like that.
Really?
Yeah.
Alright, reflexes are too close. Now I'm going to do a Babinski test on you. And I'm going to run this pin down your foot and we're going to see if it's negative or positive. Let me see your foot. Alright, test is negative. Alright, let me see this one. Alright. Test is negative. So now, I need you to stand up for me. I want you to cross your arms and close your eyes. Alright, we're going to stand there for 60 seconds. Close your eyes. Alright, can you put your arms out? Keep your eyes closed. Put your arms out in front of you. Almost done. Cross them again. Alright, good job. Now I need you to come over here, but stay in the frame. Alright, I want you to walk on your heels. Alright, now come back to me and walk on your toes. Alright, now I need you to turn around and I need you to hop on one leg towards the camera. It doesn't have to be a lot, just hop. Alright, do the other leg. Alright, turn around for me. Any tenderness in your spine?
No.
No? Alright, now I need you to bend over and touch your toes. Alright, you can stand back up. Now bend side to side. Other side. Good job. Your physical assessment is complete. Everything looks good. Now we're just going to do some patient teaching. So, Mr. Davis, I see that you have a history, a family history of stomach cancer, lung cancer, hypertension in your family. Is that correct?
Mm-hmm.
Okay, so here's a couple of things that I'm going to teach you about.
Okay.
Well, first of all, you have a history, I see, of joint pain. Is that right?
Yes.
Chronic joint pain?
Yes.
When did that start?
I don't know when it started.
Did it start recently, or did it start
You're talking about
a
for
few
me?
years ago? Yeah, joint pain.
5 years ago.
5 years ago? Okay, have you ever been to the doctor for it?
No.
Alright, so the things that you can do for joint pain, you can take some NSAIDs, which are going to be your ibuprofen, your Aleve. That's going to help the inflammation around your joints. But you do need to follow up with your primary care doctor so that they can do like an arthritis panel on you. There's not very much you can do for arthritis besides take those medications. And so that's really the only thing. You may can do some heat, you may can do some ice to help with some swelling around those joints too. So hypertension, high blood pressure. You don't have it, but your family did.
No.
You've never had high blood pressure? No?
No.
Okay.
Nobody in my family has high blood pressure.
You told me somebody did.
You sure you got the right patient, man?
I'm sure I have the right patient. You told me that one of your grandparents had high blood pressure.
Okay.
Okay.
Yeah.
So, to prevent the high blood pressure, you just need to eat a healthy diet. Do you eat a healthy diet daily?
Yes.
Okay.
Fruits,
Is it-
vegetables, and salads.
No you don't eat salads every day, but low in salt.
Yes.
Okay. You need to make sure that you're eating your fresh veggies and your fruit. One thing about hypertension is healthy weight. According to your BMI, you are slightly overweight, but that does not mean that you're obese. Your BMI is 32, and the healthy BMI is below 30. So, to prevent hypertension, technically you're supposed to lose some weight. You do smoke or you vape. Alright, so stopping smoking can help get rid of hypertension too, or not develop it, prevent it. And do you drink a lot?
No.
No? Okay. About how much do you drink?
Recreational.
Occasionally?
Yeah.
Like just with friends every now and then?
Yeah.
Okay. So you can have up to 2 alcoholic drinks a day and it still not affect your blood pressure as it should. Or like drinking excessively. So as far as stomach cancer goes, the overweight thing again. So you can fix a lot of problems by losing some weight if you wanted to. You're at a healthy weight for you, but according scientifically to your BMI, again, you're overweight. Physical activity. You move a lot at work anyways, so you just need to make sure that you keep up with physical activity. This is just some prevention measures for the stomach cancer. A good diet. So you need to make sure that you're getting your carbs, your vegetables, your fruits. You need to make sure that you're getting some of your vitamins in, some of your electrolytes in. To limit the alcohol, but you don't drink as much anyways. Have you ever been diagnosed with H. pylori?
No.
Okay, so that's a bacteria that's in your stomach. And if you have H. pylori, you're more at risk of getting stomach cancer. So, but do you have acid reflux?
No.
Okay. Bless you. The H. pylori can cause terrible gastritis, which chronic gastritis, chronic H. pylori can lead to stomach cancer as well. But with you taking NSAIDs a lot for your joint pain, it is said that that can help reduce the risk of the stomach cancer, but I don't suggest using that as a preventative measure for stomach cancer because it also increases your risk of bleeding with you taking NSAIDs like that. With a history of lung cancer, you know, you gotta stop smoking, you gotta stop vaping. How long have you smoked?
15 years.
Yeah. So you've got to stop smoking if you want to avoid lung cancer. Are you around anybody that does smoke?
No.
Nobody at all. Were you when you were a kid?
Yes.
Did they smoke like in the house
Yes.
and in the car with you? Yeah. So that secondhand smoke can have something to do with lung cancer too if you do develop it. Depending on what kind of chemicals you're working on at work. Those chemicals, some of them have carcinogens in it, and that can cause lung cancer. There's something. Have you ever had your home checked for rayon?
No.
Okay, so the rayon can cause lung cancer too. Are there any questions for me?
No.
None at all.
No.
Okay.
I think you pretty much covered everything, Doc.
So we need to lose some weight. We need to stop smoking.
Rude.
We need to stop smoking. We need to eat a healthy diet. And we just need to limit the drinking and stay physically active. And then that would help with a lot of preventatives for you not to get the cancer. Or any cancer. Okay?
So how do you tell if you get the cancer?
You'll have to go to the doctor. And they'll have to do a whole bunch of tests for you.
Well, what does it feel like if you get the cancer? How you know?
So you'll drop weight immediately. Not immediately, but I mean like you'll drop weight faster than what you usually do. May have some acid reflux, maybe some fever, you'll have some pain, may have some blood in your stools, may have blood in your vomit. And then they'll do tests. And if they can't figure out why those things are happening, then that's when they can scan you and look at your blood work and stuff too. And when they scan you, they may see a tumor or something, and that could be the cause of it, would be the stomach cancer. Same thing for lung. For lung cancer, it'd be if you had really short of breath, you were coughing all the time, maybe had some pain in your chest. And then that could say if you had lung cancer too. Okay? Any other questions for me?
No, ma'am.
Thank you so much.